Hospital readmissions remain a major problem in healthcare. One of the most common reasons for readmissions is pneumonia. 140,000 pneumonia-related readmissions each year cost the U.S. healthcare system over $10 billion annually. What if there was a simple way to reduce readmission rates? Let's take a look at why these readmissions happen in the first place. Every year, thousands of patients are admitted to undergo major surgeries that require prolonged downtime, such as hip fracture surgeries. When patients are bedbound, their lungs are prone to filling up with mucus, especially if they are not taking deep breaths. An incentive spirometer is a device that is used for lung expansion. It is used to help prevent hospital-acquired pneumonia in less mobile patients. Patients are asked to use an incentive spirometer by taking deep breaths. Proper use of an incentive spirometer is critical to prevention of pneumonia. A nurse or respiratory therapist will check regularly to see if a patient has done it correctly, but they only rely on the patient's word and have no way to verify patient compliance. The problem is that patients often forget to use the incentive spirometer or don't use it correctly. As a result, patients' lungs will fill with mucus and bacteria. It's not until a few days later, after the patient has been discharged, when the major symptoms of pneumonia appear, like shortness of breath, coughing, and fever. This major issue with incentive spirometers has been unsolved until now. Introducing InSee. With InSee, you can verify proper patient use to improve the effectiveness of incentive spirometers. InSee is the first of its kind, an inexpensive, reusable sensor that attaches to an existing spirometer. Now healthcare providers can see how often their patients are using the incentive spirometer and how often they achieve a deep breath. InSee will help identify those patients that need more coaching on deep breathing, as well as those patients who are already doing a great job. InSee will even remind patients to use their incentive spirometer. Finally, doctors, nurses, and respiratory therapists will be able to figure out which patients to allocate more resources for and prevent readmissions. InSee will be a game changer for the medical community. The need to reduce hospital readmissions has never been greater, and InSee will help us accomplish that. Visit us at tidalmed.tech to learn more at Tidal Medical Technologies.